as possible. So we're probably gonna go through the lab teaser that we shared earlier, and we received all your responses. Thank you so much. And then there were separate questions that were sent to Dr. Faisal. We will be answering those. And then at the end, if need arises, Dr. Aftab will be explaining the queries with the help of the models. So let's start with the teaser with a task by task. But I'm not going to explain it myself. I'll be actually asking certain groups to respond their answers because interestingly, most of you answers were correct, okay? Except for few minor mistakes, but there were like few of them that few of the mistakes that we noted that are kind of repeated by different groups. So I'm going to address that, but most of you did really good job. So let's start with task 2 because task 1 was simply identification of the thyroid while doing it at a self-examination. And this is something that you'll be doing it in detail when you do the professional skills and the examination of the during the endocrine system later on. So the first task was related to the thyroid, and somebody can, maybe any group can volunteer and answer the questions, or Dr. Fessel, how do you want to pick it up? This is your call.
Let's see.
Because I don't want to teach here. I want a little interaction and an involvement from the students.
So any person who come forward.
Or maybe we can start pointing the groups if there nobody come forward or the persons.
Or are you guys there?
Yes, can I answer?
Yes. Go ahead.
Yeah.
Can you please introduce yourself before you answer, just to have a little bit of familiarity with your name? Thank you.
I'm Shifa Al-Amoudi.
Okay, Shifa. Go ahead.
So I will read the scenario. A 40-year-old woman complaining of excessive weight loss, hunger, heat intolerance, tremors, and palpitation was found to have follicular carcinoma of the thyroid, and complete removal of the thyroid gland was indicated. After thyroidectomy was performed, the patient started experiencing hoarseness in her voice. So the first question, what is the causes of hoarseness? So I believe the causes is injury in the superior or the external laryngeal nerve.
Okay. Can you stop there? Anybody else can just say that if she's right or wrong? Anybody? Come on, I need people to wake up. Okay, so nobody wants to. It's okay. So what about
Hello, doctor?
Sorry?
That's right, yes.
Hello?
Go ahead.
Go ahead.
Go ahead.
I think the problem is with the recurrent laryngeal nerve, not the superior.
Yes. Can I have your name, please?
Tasneem.
Tasneem, yes, absolutely Tasneem. And I forgot the previous name. It's not, this is the problem that exactly, thank you so much, ladies, because some of you actually mentioned the external or the superior laryngeal nerve instead of the recurrent laryngeal nerve. And that's why I want to make it clear, because actually, if I go back to the slide here, yeah, this one. So yes, there are like two types of nerves here. So one is the superior laryngeal, the other one is the recurrent laryngeal, okay? Now make one thing clear, apart from the damage or the injury or the course, that the superior or laryngeal is actually giving up the external and internal branches. And this is the nerve which is supplying only one muscle, that is the cricothyroid muscle, which is the only tensor, the muscle of the larynx. And it only, if it damages, like on one side, it just gives a little bit of like a variation or a problem with your pitch, sound of the pitch. And there will be loss of sensation in the lining of the above the vocal cords in the larynx. But as compared to the recurrent laryngeal nerve, this is the nerve which is supplying all the muscles of the larynx, okay? And especially that muscle which is the only sole opener of the vocal cord, okay? So if you're going to damage the recurrent laryngeal nerve, that means you're losing almost all the muscles of the larynx of one side, and that will actually create a problem with the voice, that is the hoarseness. And it's like of a husky voice, because you'll not be able to openly properly open the vocal cords of one side. If you have a bilateral involvement of the recurrent laryngeal nerve, so that is the like then there will be a problem with the aphonation, or there will be a cadaveric stage, and that is why you will be there will be a problem with the breathing as well. Okay, so this is the difference. Remember, whenever you have hoarseness, it's the recurrent laryngeal nerve, and if you have a problem with the recurrent laryngeal on one side, and if you have a problem with the pitch or a little bit of changing of the sound or the voice, not the sound, voice, then there will be a problem with the external laryngeal because it's supplying only one muscle. I hope it is clear to everyone now.
Doctor, I have a question.
Sure, go
So
ahead.
actually,